You're listening to Healthcare Now Radio. Stand by for This Just In, the latest in healthcare innovation and technology trends with your HIT advisor, Justin Barnes.
Thanks for tuning in. I'm Roberta Mullen from Answers Media Network and Healthcare Now Radio. We're actually hosting a special episode of This Just In today regarding the Health Innovation Think Tank that many of us have recently seen published. I'm joined in the studio with Justin Barnes, the co-founder of the think tank, and we're going to be discussing this initiative and its future. Justin, it's been a while. I know you've been very busy this summer. I can hardly get in touch with you, but thanks for joining us and helping us talk about this initiative.
Thank you. It's great to be back in the studio with you. It's been far too long.
So tell us a little bit about the think tank, the Health Innovation Think Tank.
Sure. About a year and a half ago, a group of us came together and just decided to how can we create a model initiative that brings together organizations from the entire sphere of healthcare? A lot of us tend to collaborate in silos. When I was founding the EHR Association and the board there, I worked a lot, obviously, with EHR companies and health IT innovators. But I didn't work with payers as much. I didn't work with, I tried to work with providers, but, they had their own, the AMA and ACHP and a lot of other organizations where providers all collaborate, but we never collaborated as groups together. So here we brought in hospitals, physician practices, large hospitals, small hospitals, large practices, small hospitals, stakeholders from Capitol Hill, government officials, CMS, HHS, ONC, even OIG, all the way to payers, and certainly health IT innovators and EHR providers and alike, and then thought leaders in general. And you've got to, in those spaces, you kind of have to be a thought leader, because we want you to be open to collaborate, share ideas, know how to work well with others as well. And that's very important. We usually get at any given think tank 50 to 60 of us together. And we try to be friendly to each other, not speak over each other, and just learn and know how to collaborate very well with large groups. And so there's usually a best practice in there, and there's usually a lot of wisdom in there, and there's a lot of expertise that goes along with that. And so we want to bring all that together in the think tank, and we did very successfully. We've had 3 so far, and we have our 4th one coming up.
So like our health data that we need to exchange and collaborate with, exactly. So do the people.
You got it.
That's right. So what was the reasoning behind, and why did you start the initiative?
Yeah, so I just think there was such an opportunity, and specifically we tackled value-based care, connected health, and virtual care. And so those are 3 big strategies that the industry and healthcare in general were kind of struggling with or looking for additional expertise. And so we put together people, again, who have proven best practices in these areas, people who have been published through case studies, white papers, or I just happen to know I'm very fortunate to have a great sphere of peers in the industry. And so I said, you know what? I know many of you doing very well in some of these areas. Let's get together again as a collective body, share what we know, hopefully be able to help others avoid the mistakes that we've made in the past. And again, just come together and, hey, let's document it. Let's publish it out. And then let's come together again, say every 4 or 5 months and find out, again, what else have we learned? What more have we learned? And what can we share out there? How can we help others? And it's really about sharing and giving, and then also learning. We all will strategize, and we'll, people will throw up ideas and say, hey, have you thought about this aspect? Well, no, I haven't. Well, next thing you know it, we're sitting there building out a whole new best practice as a collaborative team. And you get just great organizations together, like UPMC and Duke and Partners and Christus and University of Virginia and then Boston University Medical Center and dozens more. And then you bring in a lot of the innovators, you bring in policymakers, you bring in payers, you really start to create some really cool solutions and share awesome best practices and then create new best practices, which is just a lot of fun. So that's the reason we did it. We just saw the opportunity. No one pays to be a part of this. It's not a fee or anything like that. It's a lot of my peers, a lot of my friends and friends of some of the other co-founders and we all just get together, kind of put down our swords, because some of us, I don't compete with anybody because I'm not technically in the private market and sector anymore like that. But everybody puts down their swords. We all are we're all our friends. We look at it at a higher level, and we're trying to solve healthcare's biggest problems, and that's what we do. It's fun.
What do you hope to achieve in this?
So by bringing everybody together, I think breaking down silos, number one. We talk about, hey, data silos, we need more interoperability, which is very true. We're always pushing to open up data flows and sharing of information, but also just collaboration. I think if you look out, even outside of healthcare, you look at a lot of our friendship circles, you look at our communities, you look at politics, we tend to be retreating back to our corners in so many ways. And just think about, hey, if we all got together, try to understand the other person, try to collaborate, communicate, build bridges, build more friendships. That's a precipice, and that's the foundation of the think tank. And now let's solve some of the biggest problems in healthcare with this platform, with this community. And that's what we've been able to do. It's really cool. So like I mentioned initially, we got 55 of us together. That was back in June of 17. And then in October of 17, we brought together another 60 or so people. We took about 30 from the first think tank. We add on 30 new people. And so now we've got all these new people that are part of our process. And every time we bring about 50% forward. And so we had a third think tank back in March at HIMSS in Las Vegas. And again, we brought about 25 or 30 that had previously been a think tank, and we added on 25 or 30. And again, you kind of this leapfrog effect is you're carrying forward ideas, so you have continuity, and you're always adding new ideas and new best practices and new collaborators. And so now we've probably collaborated with a little over 100 people, and it's just been a lot of fun. And we have our fourth think tank coming up in a couple of months, and I just think it's a great opportunity to break down silos, collaborate with peers, collaborate with new friends, make new friends, and again look for solutions to solve our biggest problems. And virtually starting off with value-based care and creating some really cool best practices around that, and then connected health and IoT and security, and looking at some really great best practices and key takeaways there. And then virtual care. I think that's obviously a burgeoning piece of, we know how healthcare is going to be delivered moving forward. So you pull those aspects out, and you look for the best practices there, and just giving people ideas on where to start, how to start, what are good benchmarks, what are ways to do well kind of out of the gate. Don't make some of the same mistakes that a lot of us have made in those areas. And so we share all of our battle scars. We open the kimono for everybody. And again, we just kind of lay down all our swords and look at how can we help each other? How can we create a better community? And how can we really work together as a team? So it's so far, it's just been a lot of fun, a true blessing to be a part of. And I've just made some amazing friends through this process as well.
So I've been reporting on health IT now for 10 years. Mm-hmm. And I think one of the first phrases that I heard that we needed to get rid of was the silos. Yeah. And here we are 10 years later, still talking about our data in silos. Mm-hmm. Now, when we get together in 10 years, Justin, and talk about what's going on in health IT, are we going to be talking about how to get data out of the silos? Are we?
Boy, if I have my crystal ball for that one.
I'm giving you 10 years to get the data out of the silos.
I know. So David Brailer and President Bush back in 2004. So that was the framework for strategic action that they launched in 2004. Right. By 2014, we should have had widespread interoperability, and I guess it's 2018, and I don't think we have it quite yet. But is it a process? Yes. Is it an evolution? Yes. Can we always do better? Yes. And don't let the enemy be the, evil of progress, and let's keep the ball moving. Let's keep sharing data. I mean, I just saw some great posts where Miki Tripathi now he's part of Commonwealth. I was actually I was the first founder of the Commonwealth Health Alliance, as well as Sequoia Project and their care quality initiative, and really bringing them and bridging them together. And Miki Tripathi now is part of both as well. He's on the board of both. I just love to see that, being able to enable interoperability, get it widespread, get everybody kind of on each other's boards so we can work together as organizations, not compete, but collaborate and really share data and interoperability and just keep pushing. So in 10 years, will we have solved it? I don't know if we would have solved it, but I think data will be flowing in many more places where it needs to. I do believe in the API, the open architectures in those capacities. APIs have enabled more interoperability than ever before, and we see more people pushing on that as a structure, as a strategy. So I'm very optimistic, but I'm an eternal optimistic. But I think we just got to keep on pushing.
Yes, you are. Well, I promise to come out of retirement in 10 years to talk to you,
There
Justin.
you go.
Okay. All right. So back to the think tank. Tell us who is involved. Who are the actual party players?
Yeah. So we have, like I said, almost 100 organizations involved at this point. But I mean, from the health plans, UPMC actually as a hospital and a health system, but also as a health plan. Northwell, Thomas Jefferson, University of Virginia Health System, Duke Partners, Resurgence, Christus, UT Southwestern Medical, Boston University, Tahoe Forest, Pratt Regional, literally Nemaha County, of all sizes, hospitals and health systems of all sizes, practices of all sizes, like Florida Association of ACOs, but then also some of the, HHS and Cerner and Meditech and CPSI and NextGen and Philips and Change and McKesson. There's tons. MedAllies and Practice Fusion and CDW.
This is Justin's Oscar award.
Well, these are thankfully.
And he excludes saying that he missed someone, right?
Right. Well, I am so grateful for these people for donating their time and volunteering and participating. But it's also I want to get. It's a broad swath of the industry and the marketplace, and it's just kind of cool to have all these people coming together because again, under one tent, they haven't before. Maybe HIMSS. But we don't tend to, we love HIMSS, but we don't tend to collaborate together inside of HIMSS unless it's a specific initiative. So it's kind of cool that we've done this. But yeah, it's organizations of all sizes, and as long as you're a thought leader in the market, you've got a proven case study in an area that we're researching or a published white paper and something like that, then you can certainly be a part of future think tank.
So that's how someone should, if someone was listening today and said, I want to get involved with that, what is it that you want from them?
Yeah, I think it's important to look at, your collaborative style. Have you been a published thought leader on some of these topics? Are you a great collaborator? Again, when I left Greenway, I think after we sold the company, I want to say I was on 14 boards. So, I was kind of like a serial collaborator, and I still am. I sit on a lot of private corporate boards now and some public boards. But it's, I think that's an important aspect to really getting to the bottom of results. And I think that we see the toxic environment that sometimes is in politics and even inside of some of our communities and some of our companies. But if you have the philosophy, hey, I want to listen. I want to hear what you're saying. I want to understand what you're saying. And then I want to help solve collective problems. If that's your mindset and it's display, and we've seen that before, then yes, we certainly want you to be a part of it. But also you have to then have behind that have the published case studies or the published white papers in the areas that we're talking about. And so I'll even, we'll in a few minutes we'll talk about what some of the future think tanks will look like and what we're talking about. But if there's relevant content, certainly even in value-based care, connected health, and virtual care, please send them to me, justin@justinbarnes.com. I would love to be able to see what you have, because we actually have a community that we're standing up around this, and we're publishing this out on LinkedIn, on our websites, and other social aspects. So,
well, that's a great segue, because you are publishing some things. So what are some of these key findings and best practices that the group has come up with?
Yeah, and there's pretty broad. This was actually one of the most difficult projects I've ever tackled in my life. Again, we had 3 think tanks, and after each one, we've kind of boiled down, hey, what was said? What are the best practices? What are the key takeaways from our conversation? And it was vast. These people were very smart and have a lot to say and a lot of great content. And as the kind of the moderator and the master of ceremonies for these events, I was taking copious notes. I have a great team around me that was taking copious notes. We captured so much phenomenal content from the day. But then how do you turn around and share that back out in digestible formats? And that took several months for us to kind of tackle, because the first time we put a compilation together, it was great, deep content that no one would read. And that's the problem, is people write all this voluminous content. It's phenomenal. Very few people in the world will ever read it. So I said, you know what? Let's put on kind of my sales and marketing hat for a minute here and say, what can we create that will be digestible by the common industry, the people who are seeking these type of results, but have a lot on their plate. So let's put it in digestible chunks. So we actually boiled it down to 13 slides and very succinct bullet points. So specifically now, here are some of the highlights. Like UPMC gave a great best practice around how they would, very first thing I would say is they and also partners look at every patient through a value-based care lens, not just a fee-for-service. So how do we best treat this patient? What's very best for this patient? Not necessarily how do we get reimbursed for the service, but how do we very best treat this patient? That's a novel idea because most people, there's a Hippocratic oath out there. However, most people look at you, only give certain procedures on how I can bill for them. I know living examples. My grandmother was just thrown out of a hospital because her Medicare ran out and I happened not to know what was happening. I would have fixed it if I had known, but she had a fall. Her 13 days were up. Medicare was done reimbursed and the hospital got her out of the hotel before I knew about it. I was furious, but my grandma was already home. But those kind of things happen. So I know every single day, but there's great organizations that, hey, this is how we can look at that patient. This is how you can still benefit as an organization, but also make sure the best interest of the patients, is at hand. And so we went through some best practices on how you can do that, how you can actually generate, 100 by looking at value-based care, what's available for reimbursements. How do you integrate value-based care reimbursement into your current structure, and how you can maybe make 110% of what you're being paid before? Make that money now, make 110% of what you're making before, So it's kind of cool to see 10% increases by integrating value-based care models. And so we go through different strategies like that. Another thing that was shared, and actually UPMC is doing this, is looking at the area deprivation index called the ADI. I think this was published by the University of Wisconsin. And they actually have a map that you can layer over your current database and actually layer out a topography of chronic diseases. So you can see people in a community that have cancer or CHF or other chronic diseases, and actually be able to say, hey, you know what? We're going to proactively put a care center in that community to help with treat diabetes or whatever their issue is. Yeah, you're going proactively into that community. Right now, most health centers and hospitals treat care reactively. Who walks through the door? Well, they're actually dealing with it and handling it proactively because you know what? We have a high case of diabetes in that community, or again, cancer or CHF or different types of cancer, whatever episodes. And they'll actually put a care center or a practice or whatever that needs to look like in a community and go attack it proactively and try to reduce rates. And so that's just one example. I think another one that came out collectively is around virtual care, which is, I love this because I'm a big proponent of virtual care and all that goes underneath that umbrella. And that's looking at a community and saying, you know what, or looking out in your health system, what you can open kind of in your doors and say, we're going to tackle this with 1,000 patients. We're not trying to boil the ocean and create a virtual care model for our entire population. We're going to start off with 500, 1,000, or 2,000 patients and handle it small, work out the kinks, and then enlarge it from there. People get too overwhelmed and don't start anything. And that's one of the biggest things that came out of the think tank is start small and then begin to engage these different strategies. So that was kind of cool. And again, we have 13 pages of this, but I think this is, and we'll talk a little bit later where they can find it, but it's kind of cool about giving people the confidence on how to start and where to start. And that's what some of the cool stuff that came out of it.
So moving forward, where are we going with this think tank?
Well, we have another one scheduled for, I think it's September 25th. We're going to do it in Raleigh. And again, if there are people out there that have proven best practices in some of these areas, I would love to, hear about them. You can email me personally. And we're going to shift the themes a little bit coming up. We're talking about consumerism and elevating the patient experience. We're talking about collaboration. I just kind of went on a couple times about collaborating. But when you talk about collaboration, we're talking about advances in care collaboration as well as care models for improved outcomes. And so how can what best practices are out there around people collaborating for care for a patient? And then what care models are really, truly showing better outcomes? Because I know we're always trying to save money in value-based care. But where can we turn around and say, all right, these care models, this collaborative structure or spirit or strategy, whatever, is really advancing and improving outcomes. So consumerism, elevating the patient experience, collaboration, it's advances in care collaboration, care models for improved outcomes. Then the last one is innovation. ramping up the future of care with IT innovation. I love to highlight cool innovations that are making demonstrable evolutions in our industry, wherever it is. I want to see them. I want to hear about them. I'm not looking for something that's kind of new in someone's brain. I'm looking for things that have been rolled out, seeing initial progress. We're improving outcomes. We're improving care quality, and we can quantify it. We can show exact examples. We can prove it. We have a case study around it. Or we're dramatically lowering cost. And here are 4 or 5 case studies on how we've been able to save money, drop more money to the bottom line, or we've been able to reward the care team. This is one thing. This is the best practice that came out. We always talk about, hey, we saved $4 million through a value-based care plan, and we were able to save the health system some money. We gave our foundation a little bit of money. All of our managers or C-suite got bonuses. What about the frontline staff? One of the very best practices that came out of our think tank is most of your patients check in through the front desk, or the front counter. Incentivizing those people to capture the right information and handle them appropriate, because it's not just about checking somebody in. There's special processes that had to be handled right from the very get-go, things that can be managed or researched ahead of time, or there's actually a lot on the transactional side where we're trying to get pre-authorization. There's just so many aspects in the front desk staff that they handle, scheduling, reminders. Again, those people, make sure they're getting incentives. That was one of the biggest best practices that came out in value-based care is, hey, are your incentives rolling all the way through the organization? Is everybody in your care model incented to do their job? And if they are, you're going to get much better outcomes, and that's proven. So that's kind of cool. Again, it's not just the bosses and the managers and the C-suite. It's the frontline staff. It's everybody involved in the process of they all being incented to do their job.
Give us a snapshot of the actual physical format that you use when you're there, because you keep saying all this stuff. It's like, if someone actually went there, what would it be like? Are 2 or 3 things going along at the same time? What's going on?
No, this took a lot of work. This took about 2 months to figure out, because everybody has a microphone. We look for rooms that we can only host it in so many places, because not many rooms come with 50 microphones or even 35 microphones where some people can share. And then also we like a semicircle. We want everybody, again, these are all thought leaders. And so everybody wants to speak. And so we actually have a structure where we kind of start off with a couple of catalysts, people that either I've known for a long time, they're great collaborators, like Dr. Rasu Shresha, who a lot of us know from UPMC. We love him. He's great. Kamal Jithwani from Partners, Lee Williams from University of Virginia Health System, to Dr. Sylvan Waller. He's a great thought leader on virtual care and remote monitoring and telemedicine. So a lot of people like that, and many others. Hank Vanberg from Christus. People that kind of speak for 5 minutes, kind of get our brains flowing about some of the really new cool stuff. Dr. Jack from Boston University. In their own domain, they'll give us maybe 5 minutes on what they're doing to kind of spark some really cool ideas. And then we as an organization, as a think tank, we will start to share our ideas based on what they said, and then also some of the stuff that we're working on. And then my team will take copious notes. We'll capture everything. We film it, we record it, and we take notes so we can come back and highlight it and compile it. But it's a neat structure. Again, I've never seen this done where we all kind of meet in a semicircle. We had this catalyst structure, but again, you got 50 thought leaders in the room, and great ideas come out. Everybody usually speaks. There's no one that doesn't speak, but I want that. And I say everybody has a chance to speak because,
there's only one arena going on at a time. You don't have to
we don't do breakout sessions. We all tackle this. Everything's very structured. Mm-hmm. I come from a very structured, even military background, so I'm going to run an agenda. We stay on task. We stay on target. We don't let crosstalk. There's kind of some ground rules. But again, all these people are good collaborators and communicators, so they know not to talk over other people and have all these sidebar conversations.
It's a whole day, 2 days?
It's usually, we'll have people fly in the night before, and then for a little reception, then we go from 8 to 3 and everybody flies back out. So kind of fly in, fly out. So yeah.
All right, so tell everybody now, where can people find and learn more about this?
Sure. So healthinnovationthinktank.com is the website. It's a temporary one that actually me and my team have built kind of off my personal site. But we'll be standing up its own site here very, very shortly. But out there, you'll find our published best practices where they are, and we try to keep always the most latest version there. But again, healthinnovationthinktank.com. And if you have any content to share with me or input for me, Justin at justinbarnes.com. Do feel free to reach out to me and let me know.
And we'll put all the links on your program page on Healthcare Now Radio.
For sure.
Too.
Thank you.
For sure. Okay. Well, we're almost here to an end, and I know that you love to ask your guests some questions at the end just to get a feel and know them, right?
Yeah.
And so tell us where your favorite place is to get inspired.
So it used to be the water. I do have a boat, and I love to be on the open water, the open ocean, or a large lake. But recently, my wife has started an initiative called Life Totes and Life Give, a nonprofit, and now we do a lot of work over in Cambodia. And I became extremely inspired when she's been over there like 13 times. I went over the first time last summer. And just we have an amazing initiative over there where we take care of 23 children in this children's home. And one of those children has actually just joined us here for the next 8 years. We're going to put him through high school, put him through college, and hopefully start him a small business when he graduates. So I got inspired over in Cambodia, and it's changed my life. So that's been my newest thing. And obviously the Bible is a big inspiration for me too.
I believe you had your wife on your show when she started this.
Yeah, about a year and a half ago.
Yeah, and you can find that in his playlist.
Yes, and I need to have her back. She's done some amazing work even since then.
Yeah, that's great. Well, Justin, our time has come to a close. Great to get back with you in the studio.
Thank you. So thanks everyone for joining us, and please tune in weekdays at 2:30 p.m. Eastern, 11:30 a.m. Pacific for our latest shows. Thank you very much. See you soon.